If your home health agency is waiting 60, 75, even 90 days for Medicare payments while your bills pile up and staff need paychecks, you're not alone. In the next 6 minutes, I'm going to show you exactly why home health agencies face these brutal, slow reimbursement cycles and the specific strategies high-performing agencies use to cut their collection time to 35-45 days instead of the industry average of 60-90 days. Here's what's really happening to your cash flow. Since Medicare switched to 30-day periods of care instead of per-visit payments, home health agencies are trapped in a perfect storm of longer payment cycles, complex documentation requirements, and increasing regulatory scrutiny. While this system provides more predictable revenue per patient, it creates massive cash flow gaps that are suffocating agencies across the country. Let me put this in perspective with real numbers. A typical 50-patient agency providing care at an average reimbursement of $2,050 per 30-day period faces serious cash flow pressure. With standard 45-day payment cycles, you're carrying $154,000 in unpaid receivables at any given time. But when delays stretch to 75 days, which is becoming increasingly common, that number jumps to over $256,000. That's enough working capital to fund significant expansion or weather unexpected challenges, but instead it's just sitting there, tied up in the system. And here's the thing that makes this even worse. Late payments don't just affect one patient, they ripple through your entire census, creating cumulative cash flow shortages that force agencies to turn away new patients, delay equipment purchases, and rely on expensive credit lines just to make payroll. So why is this happening? The complexity of home health billing creates multiple failure points that extend payment cycles far beyond what other healthcare sectors experience. Home health claims face stricter documentation scrutiny than most healthcare sectors. Medicare requires comprehensive records proving medical necessity, homebound status, and skilled care justification for every single patient. Missing even one element triggers automatic delays. The patient-driven groupings model, or PDGM, determines your reimbursement rate based on patient characteristics, but coding errors create expensive delays that many agencies don't even realize they're causing. Agencies without deep PDGM expertise frequently experience incorrect grouping assignments, missing secondary diagnoses, and therapy threshold miscalculations that can delay payments by weeks. Then there's Medicare Advantage prior authorizations, which add another layer of delay that many agencies underestimate. MA plans often require pre-approval for services that traditional Medicare covers automatically, extending your cash cycle by weeks while you wait for approvals. But here's what's really costly about slow reimbursement. When cash flow problems become chronic, they damage your agency's financial health in ways that extend far beyond temporary inconvenience. Extended accounts receivable ties up capital that could fund growth initiatives or operational improvements. Claims aging beyond 120 days face dramatically higher write-off risks. We're talking about 5% or more of billed charges written off as uncollectibles, when proper denial management could have recovered much of that revenue. And if you're relying on credit lines to bridge payment delays, you're paying interest expenses of 8 to 12% annually on revolving credit. An agency borrowing $200,000 regularly pays $16,000 to $24,000 per year in interest that proper cash flow management could eliminate entirely. Now here's what's interesting. The agencies that maintain consistent 35 to 45-day collection cycles don't rely on luck. They implement systematic approaches to every stage of the revenue cycle. They start with front-end documentation excellence. Your reimbursement speed begins at patient intake, and agencies that collect fastest invest heavily in comprehensive admission processes that capture complete, accurate information from day one. The difference between 30-day and 60-day collections often comes down to claims quality. Agencies with deep home health expertise understand the specific documentation requirements that prevent automatic rejections and medical review delays. When claims do get delayed or denied, response speed determines recovery success. Agencies that maintain strong cash flow dedicate significant resources to working denials immediately rather than letting them age. This requires both clinical expertise to address medical necessity questions and billing expertise to navigate payer-specific requirements. The most successful agencies track leading indicators that predict cash flow problems before they become critical. They monitor days in accounts receivable, clean claim rates, denial rates by payer, and average time to resolve denials. But here's the reality many agencies face. Slow reimbursement problems often stem from staff lacking deep understanding of PDGM intricacies, Medicare coverage requirements, and payer-specific documentation standards. Many agencies find themselves constantly training new billing staff on complex regulations, only to see experienced employees leave for higher-paying positions elsewhere. This creates a cycle of knowledge loss that directly impacts collection speed and accuracy. The specialized nature of home health billing requires understanding both clinical documentation and complex reimbursement rules that take months or even years to master fully. When home health agencies need to accelerate reimbursement and transform their slow reimbursement operations, the most effective approach combines deep operational knowledge with systematic performance analysis. This isn't about generic billing services, it's about specialized expertise that understands exactly how home health reimbursement works and why it gets delayed. The billing companies that consistently deliver faster collections have leadership with actual home health operations experience. They understand the clinical side of documentation requirements because they've managed agencies, worked with physicians on orders, and dealt with OASIS assessment challenges firsthand, but experience alone isn't enough. The agencies achieving the best results work with billing companies that use comprehensive data analysis to identify specific improvement opportunities. Rather than simply processing claims, the most effective billing operations implement systematic improvements that compound over time. Small improvements in clean claim rates combined with faster denial response times and better documentation processes create meaningful cash flow acceleration. This comprehensive approach transforms reimbursement from a constant source of stress into a competitive advantage that supports growth and profitability. Here's the bottom line. Slow reimbursement home health agency challenges don't have to be an inevitable part of operations. While Medicare payment cycles and regulatory complexity create inherent delays, agencies that combine specialized expertise with systematic performance improvement consistently achieve 35-45-day collections instead of 60-90-day struggles. The difference between cash flow stress and cash flow security often comes down to having the right knowledge and data to optimize every step of your revenue cycle. When you combine deep operational experience with powerful data analytics, consistent cash flow becomes achievable even in complex regulatory environments. If you're ready to discover exactly where your agency is losing time and money in the reimbursement process, we can analyze your specific situation to reveal opportunities for faster collections and improved cash flow that could transform your financial performance within 90 days. Contact us today for a free consultation and let us help you streamline your home health billing operations. Don't forget to subscribe for more home health billing insights, leave a comment about your biggest reimbursement challenge, and check out our next video on avoiding the most common home health billing mistakes that create unnecessary delays.